Hi there. So I am Elicia Gonzales, and am incredibly excited and proud to be here with you today to talk a little bit more specifically about how all of what was just discussed earlier by my esteemed colleagues, how it lands on our communities, right? I'm really grateful for being part of this conversation. I think in my entire 4 years plus at being at WMF, this is the first conversation that actually didn't compartmentalize the experiences of people who can get pregnant, but actually represented them as the full spectrum, right? So like prenatal, birth, maternal mortality, as well as abortion, because at the end of the day, these are our communities that we're talking about, right? They're not some of these women over here getting this thing over here, some of these people over here getting this thing. And I think to speak to Dr. Mehta's point, today is a perfect example of the bridge building that we need to continue to strive for within our community. So thank you for inviting me. I'm not going to read all that, but for folks who don't know, WMF was started in 1985, and we protect and expand abortion access for folks living in poverty. We do this in two ways: through direct service, so paying for folks who are unable to pay for their abortions themselves, so direct service, as well as community organizing. And so we are really looking at some of the systemic inequities that are causing folks to be living on the margins and underserved, to figure out what role we have to help them live healthier and fulfilled lives for themselves and their families. I just want to point out the asterisk here, which is next to the word individuals. So WMF right now is currently abbreviated. We are a couple of weeks away from announcing our new name that will be gender inclusive. We use gender inclusive language throughout all of our conversations when we're speaking with people, and certainly when we're talking with communities, because people, individuals, they, them, all need access to abortion care. And so we just want to make sure that we're affirming folks' identities, because not doing so is actually really inhumane and violent. We know people who call us and say that they didn't even realize that they could access support from us because they don't identify as women. So we just feel like it's a small little thing that we can do that has an incredible impact. So we're one of the oldest funds in the country. For the longest time, we were saying we were the oldest fund, and nobody questioned it, but apparently we aren't. So there's that. We are the largest fund in Pennsylvania. You heard Dr. Arkush talking earlier about one of the most harmful amendments that we've seen to communities that we serve, which is the Hyde Amendment, which in Pennsylvania basically was adopted in 1985. So a group of feminists and healthcare providers recognized that they didn't have time to try to lobby the legislators at the state around, increasing and decreasing, overturning this ban. They needed to take immediate action. So they created a fund by raising money, generating revenue, and helping pay people who were prevented by the state from using their insurance to cover the cost of the abortion. We serve over 3,000 people every year. Last fiscal year, we gave out funding to about 3,200 people. One of the things that I want to point out that was hit on earlier, but that there's just layers upon layers of intersecting oppression that are facing our communities. And so one of those, as we know, is COVID, which is disproportionately impacting specifically Black and Brown communities, which are also the folks who call our helpline. So before COVID, our average amount that we would give out to help somebody was $131. It's now up to $240, which is a stark increase for somebody who's already struggling to get by. This is just, again, a breakdown, because oftentimes when we think about abortion, or if you were to Google it right now, what's going to come up is the hyper politicized conversation, and what gets lost is abortion seekers and the people who are actually getting the care. So I wanted to make sure to paint a portrait of who we're seeing in our helpline. All of the folks that we help are living in poverty, earning just over $8,200 a year. 23% were uninsured. A full 67% were on Medicaid. So combined, obviously, are all of the folks who should have been able to use that insurance to pay for this healthcare procedure. 11% were survivors of domestic violence or were pregnant as a result of non-consensual sex or rape. This is a huge number that I want to really drive home. 72% of people who call the helpline are already parenting at least one child at home. And so really abortion is a matter of family. And we hear folks constantly talking about how they can't afford the children that they have. And that one woman I actually heard talking on the phone said she would have to give up her existing children, two of her existing children, for adoption because they just could not make ends meet, right? And I also just want to point out quickly, this is to no fault of her own. We sometimes like to blame people in this country for being poor, but it's our systems and our racialized way in which we like to oppress people and to make them think it's their fault, when really the system is designed to not help people living in poverty get out of poverty. 8% of the folks that we see are 19 and under. So I think a pretty significant number. We're here today, obviously talking about public health, mental health, meditation, and all of that. Abortion is part of that continuum of health, right? It is healthcare. It's undeniably healthcare. About 1 in 4, this is stuff you probably already know, but about 1 in 4 individuals who can get pregnant will have an abortion in their life. Most of the abortions happen within the first trimester, so within the first 8 weeks of pregnancy. And most occur within the first trimester. It's incredibly safe. It's incredibly low risk. It's far less risky than actually carrying to term, which we'll talk about in a second. And the risk of a medication abortion is also incredibly low, just at about 1%. So this whole rhetoric around being concerned about what kind of damage is going to be caused to a person who seeks abortion through their physical health or their mental health, because both are lies that are told, is just not actual. It is not actual. So if it's healthcare, which I just demonstrated and which I'm sure all of you know, why is it treated so differently than other medical procedures? So for example, as we just described ad nauseum, you're prevented from using your insurance to pay for the abortion. It is incredibly public and highly stigmatized. You can't go a day probably without hearing about abortion in some way, shape, or form. Again, Dr. Arkush pointed out there's been 561 abortion restrictions introduced this year alone. There are incredible hoops and hurdles that abortion providers have to go through that are absolutely unnecessary in order to perform the abortion. The counseling is mandated by the state, not by medical providers. And so the counseling is medically inaccurate and stigmatizing. So we heard earlier just the role that stigma plays in one's healthcare. We in our state are paying folks to lie to people. So the state is complicit within that violence. And to make it even further worse, which is that the state also, for folks who don't know, fund a group called Real Alternatives. They've gotten upwards of $90 million since the 90s. This is the large umbrella organization that funds what some folks might know as crisis pregnancy centers. We are calling them anti-abortion centers because language matters, and that's what they are. They're just really trying to dissuade people from getting an abortion. They literally are getting our tax dollars to lie to pregnant people and try to dissuade them out of having an abortion. So while the state will fund lies and deceit, they actually won't fund actual healthcare that's going to help people at least stay out of going into further poverty, right? Yeah, good times. Why might that be? I don't know. I'm not going to go through all of these because you can read them, and I believe people are going to be getting the slides, but I just want to point out, because we're so knee deep, neck deep, underwater with the abortion game in this country, that we sometimes forget that it wasn't always this way. It wasn't always that abortion was such a politicized tool and something that absolutely has driven a wedge in this country. It wasn't until the late 1800s that abortion regulations started to kind of come to the forefront. It was absolutely rooted, again, thinking about these systemic inequities and how things are done on purpose, that it was because of racism and misogyny and the desire for control that caused the shift out of community care, which was typically done by midwives and other folks who were taking care of pregnancy, abortion, like the full gamut, and put into the medical, some folks would call the medical industrial complex, right? And it's just that momentum has just gained over the past few hundred years, right? It's even, I would say, worse now in terms of accessing an abortion than it was before. And at stake, there was also this idea that doctors knew better, right? That they knew better than the wisdom that was passed on from generation of generation of midwives who had all different kinds of ways to care for communities. So again, rooted in racism, misogyny, and sexism. So if I haven't driven the point home enough, let me do it some more. Abortion bans aren't about abortion. This has never been about abortion. This is absolutely about perpetuating white supremacy, right? When the laws are introduced to ban abortions, the folks hardest hit are people living in poverty who are Black, brown, and Indigenous. We see this over and over again. We see this with our PA Abortion Control Act. Pennsylvania is awful. We're not even just like one step away from Texas. Like we're not great. We have a mandated 24-hour waiting period, state mandated counseling that I talked about. If you're under 18, you have to get your parents' consent to have the abortion. If you can't get that consent, you have to go before a judge and prove that you're emotionally mature enough to have the abortion. No such equivalent exists if you want to have a child, just the abortion. And as I said earlier, just a ton of regulations for providers. Abortion is part of our nation's long and sordid history with trying to control Black and brown and Indigenous bodies. And this is just a handful of examples. I can point to many more, some of which have been described today. Obviously, slavery, forced sterilization that's gone on up until just this decade, experimentation for OB-GYN care that was on Black and primarily Black women, as well as criminalizing pregnancy, which we heard about just right before here. So these are all connected, right? And controlling abortion is the issue that feels like it tugs on people's heartstrings the most and causes people to have like pretty strong opinions about something that really should just be private. Again, you're seeing a theme maybe in what I'm talking about. So anytime somebody says, that they're pro-life, we're trying to reframe our brain into saying, oh, so you're for forced birth, because if you're denying somebody the ability to access control over their ability to have an abortion, then you're forcing to carry that person, you're forcing that person to carry to term, right? We know that this is awful just on its face anyway, because it's just immoral, it's violent. But it's made worse when you think about the racialized component of what forced birth means. We just heard earlier from Dr. Mehta talking about how Black women represent 73% of pregnancy-related deaths. Why this doesn't make the news every day, I don't know. Black women are 3 times more likely to die from pregnancy-related causes. And there's lots of disparities that different folks will kind of speculate on. The one that I want to point out, obviously, is racism. It's blatant, it's unapologetic. And if you don't believe me, you can just think about Serena Williams, Beyonce, other women who are very well off and also are Black and still experienced all of these things, right? So the common theme in that care is the fact that these folks were Black people. So what I want to do, because I assume that people are coming to this conversation, are critical thinkers, are already understanding that abortion access is healthcare, that abortion is connected to maternal health, and that there's, things that we need to do. But what I want us to do is actually pause and think about all of the things we have to unlearn so that we can actually interrogate ways in which we are perpetuating harm. That harm can come in the language that we use. It could be contributing to all of the isms, racism, sexism, et cetera, transphobia, insisting that only women get abortions, which is not accurate. It's the way that we might use old antiquated imagery that actually harms people who are trying to provide community care, like the coat hanger reference. That's an image that I know is dear to a lot of folks' heart. And also I want folks to sort of like do a little bit of digging as to what message that's sending and how that actually is perpetuating stigma in our communities. And then this one probably is even the least popular thing that I say, which is that if I see one more person post something about how we're heading down the path of the Handmaid's Tale, I literally might scream, because it's been the Handmaid's Tale for generations in this country for Black, brown, and Indigenous folks. And so it really is just oblivious when somebody uses that reference as though this is something new. So some of the resources here I would encourage folks to take a look at. These are all of the different ways when folks are just furious and want to do something. Marching is important. Obviously, folks marched on October 3rd, and we put out a call to action that if you're going to march, take the pledge to march and, right? So march and contribute money to an abortion fund. We run out of money more and more every day. We estimated that we would need minimum of $20,000 a month just to try to come anywhere near the need that we're seeing currently. $20,000 a month, right? Support an abortion provider by sending a thank you note. Volunteer for a clinic. And then, of course, on the right are all of the different resources that you can take advantage of to help, again, like unlearn some of the ways that we've been thinking about abortion access and figure out ways of talking about it in a better way, because sometimes unknowingly and for perfectly well-intended meanings or reasons, folks who were seemingly in favor of a reproductive freedom, abortion access, or what have you, we are unknowingly causing harm. So we just want to deepen it. We want to be able to figure out what is my role, what is my responsibility in perpetuating anti-Blackness. You know, what am I doing to think about harms that I've caused? Because again, there's such a strong connection between abortion access, abortion restrictions, and white supremacy that if we, as individuals, specifically individuals who are white and are non-Black people of color, to unpack and atone for our anti-Blackness, then we're actually not supporting abortion. So I'm more accessible probably than I should be, but I'm always open for conversation. If there was something that I said that struck the nerve or that you want to ask about or that you want to share your opinion, please reach out to me. Our website is here. And then some of the slides got lost in translation, but we always encourage folks to also follow along on our social media. That's like the first place people learn about what we're doing. So it's at Women's Med Fund. On all of the platforms, not TikTok, but we're not that cool. But other than that, you can find us anywhere, and we would love for y'all to come and support us to support abortion access in our lovely state. Yeah, it's been an honor. Thank you.